So the buy-in one would be the one underneath. So this is a radial pressure wave device here. This is basically in the gun. Let's call it a gun. We have a projectile, a bit of metal, ultimately, inside a tube. So if I take that off, that little hole there, it slightly pops out beyond the hole, okay, and it hits the back of that bit of metal there.
Is that like McTimoney Chiropractic?
How dare you?
Well, I don't know. I heard
a little bit different. So what that creates is this pressure wave.
Okay.
A shockwave by a physicist standard would require a lot more energy. So strictly speaking, by a nerdy physicist, this is a pressure wave device.
Okay.
Not a shockwave device.
Okay.
So, but hey ho, it doesn't really matter. So that creates the pressure wave that comes off the end of there. So that in there, the cameras might not pick it up. That's a pneumatic device with air being sucked in the back of it, which creates the pneumatic pressure for the bullet in the gun to hit the back of that creates the bang. So it makes a loud noise. Some patients get a bit concerned by that, and you start off nice and low, and then you get the patient used to the feeling of it. So it's a bit like being jackhammered. It's a bit abrasive. A bit abrasive. You definitely know it's going on. And the thing about this is that all the energy that this delivers is delivered at the skin surface and then penetrates slowly into the tissue. But as it goes into the tissue, the energy gets really depleted. Just gets dispersed. So
how long? Yeah, we're going to demonstrate. Yeah, let's have a look.
And with all things that are based on sound, you need a gel interface like you would with sonography doing scans and so forth. So to give you an idea of one versus the other, and I'll do this on you in a minute if you ask me nicely.
Thank you very much.
So for treating plantar fasciitis, it's a very simplistic type of tool, and we use the patient's feedback to say, oh, that's where my pain is. And one of the good things about Shockwave, as opposed to saving your thumbs, the plantar fascia, when you start scanning these, it's fairly thick and it's fairly deep. You can't really get there with your thumb. So a lot of the times I use Shockwave to also identify where the problem is exactly. And we know that the outcomes for Shockwave therapy are better if the patient's involved in that. They say, well, that's my pain. So all the time, having a conversation all the time with the patient saying, where's this your pain? So I think going back to therapeutic alliance, it's quite nice to get them involved and take the fear out of it. Because everyone does think, it's a machine you've plugged in, is it electrical? No, it's just a sound wave.
So if the area isn't hurting, you're in the wrong place?
Pretty much. It's more about the pertinence of their pain. So I could put this on his shin now. He wouldn't like me for doing it. But that's not relevant to his maybe symptoms. If he had plantar fasciitis, I want to reproduce his heel pain. And shockwave therapy, particularly focused, is really good at reproducing the pain of the patient. And I think therapeutically that's really important. We do with our hands, don't we? Feel that bit, and the patient says, "Oh, that's my pain." That's a good thing for them to feel that you've empathised with their pain. And shockwave is brilliant for that. They go, "Oh, that's exactly what I feel like it needs." They often say that. Like we do when we do a strong treatment with our hands or a strong massage or whatever, they feel like that's what it needs, as an instinct. So I think that's therapeutically quite helpful. So that's a low energy sound wave that comes off the end, makes quite a lot of noise, but it is also quite painful to have done. Where focus shockwave comes in.
Can I just a couple of questions on that? What sort of frequency? I mean, obviously it has a certain rhythm to it. How would you choose that, or how would you decide?
It's about if we're trying to get depth into the tissue. So the plantar fascia on him. It's quite a large chap. He's got a bit of tissue, a bit of fat underneath. So if the lower the frequency or the lower the hertz, the deeper it goes into the tissue. So if I dropped it down to bum, 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 it's that's going to get deeper into the tissue.
Is there anything to do with the tolerance of the patient? Is it less painful or more painful depending on
more painful to have lower frequency.
Right.
So we always say that you want to start off high, that numbs the area a little bit, and then you drop it down to what you think the depth you need. So if I was treating his proximal hamstring, which is deep in there, I would start off, at 12 to 15 hertz, which is what it's at now, and then I'd drop it right back to, with him, big old hamstrings, you drop it back to,
Right.
And then it takes longer than 5 minutes to do the treatment.
Yeah.
But so you can play around with that variable and just simply how much the air compressor is pushing through. So now I've whacked up he wouldn't like me doing that.
So intensity and frequency can both be modified.
Yeah, if anyone's into scanning, sonography, ultrasound scans are the same. Frequency is depth. It just has that effect. Yeah. So you can play around with those things.
How did that feel? Can I just ask? Because I haven't had a go yet.
Yeah, I could really feel it.
Yeah, I don't think you're mic'd, but you say you could feel it in what kind of way?
Just like a very slight, not pain, but I could.
Come on, let's engage you in the experience.
Yeah.
So I wouldn't choose to use this on your elbow.
Okay.
And I will drop the bar back a bit, but you will just get the sense of it being hit quite a bit. It sort of feels superficial and a bit ouchy. That's what most people describe it as, And that energy level is significantly less than the focus shockwave, but is much less painful to have.
Can we come on to that and say, I've got questions that are rolling in. Bridget asked, should you wear ear protectors?
We don't think so, no.
It wasn't that noisy.
No, it's not that noisy. No, you don't need that. And the vibrate we get after a lot, you're going to get white finger or anything else. These STORZ in particular, they've done more research than any other company by a long way. And it's all CE approved, vibration damage on your hat, none of that.